We've been in business 28 years. We've got over 1 million people using our home use equipment. In all of that time, we have never had one single lawsuit involving a physiological problem. We haven't had a physiological claim that even rose close to a lawsuit. And I'm saying this because the body's wonderfully designed to be upside down. In fact, we've all been there for about 6 weeks prior to birth. You know, that's when a fetus is building a brain, the extra oxygen to the brain while it's inverted. And in fact, some of us could use a little extra oxygen to the brain, you know, on a regular basis. So the body is wonderfully designed to be upside down, but you've got to give it an opportunity to adjust. You know, there's 2 physiological responses that are pretty much automatic for first-time invertees. One is disorientation. When you invert, even at 45 degrees, you're going to have disorientation. The vestibular system is going to tell you you're fully upside down. And there's some discomfort and some anxiety associated with that. Now, you combine that with a fight or flight response, which is also typical of first-time invertees. Your heart rate goes up, your blood pressure goes up, and the net result can be a very bad experience. However, with respect to the vestibular system and the autonomic nervous system that controls blood pressure, these systems train readily if you give them a chance. Start out at 20 degrees, even 15, and bring your patient along slowly to a level that they're comfortable with, shooting for 60 degrees to full inversion. You know, this depends on, again, the symptoms and and what you're comfortable with. This is the kind of force that will really make a difference. In 60-degree inversion or even full inversion, your body will lengthen, or the patient's body will lengthen 1 to 2 inches, joints opening up, and also there's a natural posture correction. The head, the thoracic box, the pelvic box, and the legs are all individual components of the body, and they all line up with gravity individually, actually producing that perfect S-curve. And when traction's applied with that body in perfect posture, the natural realignment is of course the most beneficial. You've also got improved circulation and improved lymphatic drainage through the gravity assisted. Now I want to talk about one point, because a lot of people are concerned specifically about increased blood pressure inside the skull, and if that would increase the chance of stroke. When you're inverted, yes, there's a hydraulic column in the artery increasing the pressure inside the artery, but it's compensated for by the cerebral spinal fluid that's outside the artery, because that's also a hydraulic column from your lower spine up to your skull. So you have compensating pressures. In fact, Dr. Klatz and Goldman, in a study looking at specifically that point, summarized it by saying that people are at more risk of doing, physically intensive exercise vertically, like weightlifting or playing tennis. They're at more risk of inducing a stroke than they are from inverted decompression because of these compensating pressures. So the point is, try it first on yourself. It will help your own practice. The benefits are substantial. Many clinicians have back problems from working over patients. It will help you with your back problems. It'll help you with your stress, and you will gain the confidence to use it on your patient. And that will make a difference. It can change lives. It changed my life. I spent 5 years with back pain problems, trying everything to fix it. Nothing really worked. Inversion fixed it. That's why my wife and I started this business. And I believe it will change your life, and it will give you the reputation of really caring for your patients and making a difference in their lives. Deal with the acute phase in your office and send them home after a few weeks with their own inversion table, so they can maintain this with a passive activity and then bring them back on quarterly tune-ups. And you'll have done a service. You'll feel good about what you've done for them, and they'll be referring a lot of patients to you. I believe it'll change your life and the life of your patients. It changed mine. Give it a try.